Imagine waking up one day with sudden swelling in your arms or legs. You feel dizzy, your heart is racing, and you can barely stand. These could be signs of something rare but serious: capillary leak syndrome. It's a condition where the tiniest blood vessels in your body, the capillaries, start leaking fluid into places it doesn't belong. This leakage causes swelling, dangerously low blood pressure, and even life-threatening complications. Most people have never heard of it, but recognizing the symptoms early could save a life. How do these leaks happen? What triggers them? And how is it treated? Stick around as we break it all down in simple, clear terms you can easily follow. This information could be life-changing. What happens when capillaries leak? The capillaries in your body play a crucial role in keeping you alive. These tiny blood vessels are responsible for carrying blood, nutrients, and fluids to every part of your body. Normally, they're tightly sealed, ensuring everything stays inside the bloodstream. But when they lose their seal and start to leak, the balance in your body gets thrown off completely. This leaking causes fluid to collect in nearby tissues, leading to swelling. The swelling isn't subtle. It comes on quickly and can make areas like your arms, legs, or face look puffy and feel tight. Internally, the situation becomes even more dangerous. With less fluid in the bloodstream, blood pressure drops significantly. Low blood pressure affects the flow of oxygen and nutrients to vital organs like your heart, kidneys, and liver. If not treated promptly, this can lead to organ damage or even failure. Doctors categorize this condition into two main types. Systemic capillary leak syndrome, often referred to as Clarkson's disease, is extremely rare and can strike without warning. It's sometimes linked to genetic factors. Secondary capillary leak syndrome is more common and is usually triggered by something else, such as an infection, medication reaction, or physical trauma. Why do capillaries start leaking? The exact reasons why capillaries lose their ability to hold fluid aren't always clear. However, doctors and researchers have identified some common triggers. Infections are one of the leading causes. Viral infections like COVID-19, dengue fever, or even severe bacterial infections can put extreme stress on the walls of your capillaries, making them more likely to leak. Think of an overfilled water balloon. It can only hold so much before it starts to drip. Autoimmune diseases such as lupus or rheumatoid arthritis are another major factor. These conditions cause the immune system to attack healthy tissues, leading to inflammation. This inflammation weakens the capillaries and makes them more porous. Certain medications, like chemotherapy drugs or treatments that suppress the immune system, have also been linked to capillary leaks. Even physical trauma, surgeries, or exposure to toxins can weaken capillaries enough to cause leakage. Recognizing the symptoms, spotting the symptoms early, can make all the difference in managing this condition. Swelling is one of the most visible and common signs. This swelling typically appears in the arms, legs, or face, and can feel tight, uncomfortable, or even painful. Another major symptom is low blood pressure. As fluid escapes from the bloodstream, the overall blood volume decreases, causing blood pressure to drop. This can lead to dizziness, lightheadedness, or even fainting. In severe cases, the drop in blood pressure can cause shock, a life-threatening condition. Fatigue is another symptom to look out for. When your body loses fluids and essential nutrients, it feels like running a car on empty. Even simple tasks can feel overwhelming. Nausea and vomiting may also occur. While they might seem unrelated, these are clear signs that your body is struggling to cope with the sudden imbalance caused by fluid leaks. If the condition isn't treated quickly, it can start to affect vital organs. The heart, kidneys, and liver may not get enough blood or oxygen, leading to serious and potentially permanent damage. How doctors diagnose it? Diagnosing capillary leak syndrome can be tricky. It's a rare condition, and its symptoms often overlap with other health issues. However, there are specific tools and tests doctors use to identify it. Blood tests are usually the first step. These tests can reveal unusual changes, such as elevated red blood cell counts or low levels of albumin, a protein that helps maintain fluid balance in the blood. These are strong indicators of fluid leakage. Doctors might also order imaging tests like CT scans, MRIs, or ultrasounds. These scans show where fluid has accumulated in the body, helping doctors determine the extent of the leaks and their impact on organs and tissues. Your medical history and symptom patterns also play a crucial role in diagnosis. If your symptoms seem to occur after certain triggers, like infections or medications, this information can help narrow down the cause. Keeping a detailed symptom journal can be incredibly useful for your doctor. Treatment options for capillary leak syndrome. Managing this condition requires quick action to stabilize blood pressure, reduce swelling, and protect vital organs. IV fluids are often the first step in treatment. These fluids help replace what's been lost from the bloodstream, restoring normal blood pressure. However, the amount must be carefully monitored to avoid overloading the body, which could worsen swelling. Albumin infusions are another common approach. Albumin is a protein that draws fluid back into the bloodstream. By increasing albumin levels, doctors can help reduce swelling and restore fluid balance. Vasopressors, medications that tighten blood vessels, may also be used to raise blood pressure. These drugs ensure that vital organs receive enough blood flow, even during severe episodes of leakage. If the condition is related to an autoimmune disease, immunosuppressants are often prescribed. These medications help calm the immune system and reduce inflammation, preventing further damage to the capillaries. For severe cases, plasma exchange may be necessary. This involves removing harmful substances from the blood and replacing plasma with fresh plasma or a substitute. It's a more intensive treatment, but can be life-saving in critical situations. For patients who experience recurring episodes, preventive measures are important. Medications like beta blockers can help reduce the frequency and severity of flare-ups. Living with capillary leak syndrome. Coping with this condition requires a combination of lifestyle changes, regular medical care, and a proactive approach to managing triggers. Staying hydrated is one of the most effective ways to support your body. Drinking enough water helps maintain fluid balance and can reduce the risk of future episodes. A nutritious diet is equally important. Focus on foods rich in proteins, vitamins, and minerals to support your overall health and recovery. Fresh vegetables, whole grains, and lean proteins should be staples in your meals. Avoiding known triggers is another crucial step. If you know certain infections, medications, or activities can set off your symptoms, take precautions to avoid them. Regular doctor visits are essential for managing this condition. These checkups allow your healthcare provider to monitor your progress, adjust treatments, and address new symptoms before they become serious. Keeping a symptom journal can help you stay ahead of flare-ups. By tracking how you feel when symptoms occur and potential triggers, you and your doctor can refine your treatment plan. Building a support system is also important. Living with a rare condition can feel isolating, but connecting with others who share your experience can provide emotional reassurance and practical tips for managing daily life. Why awareness matters. Although capillary leak syndrome is rare, understanding it can save lives. Early recognition of symptoms and timely medical intervention can prevent severe complications and improve outcomes for those affected. Spreading awareness is just as important as treating the condition. Increased knowledge can lead to more research and funding, which could pave the way for better treatments, and possibly even a cure in the future. If this video helped you better understand capillary leak syndrome, consider subscribing to Earthluxe. Our goal is to bring you health information that's simple, engaging, and potentially life-saving. Thanks for watching, and we'll see you in the next video.